Good morning, I'm Dr. Anne Ponec. I'm studying Crisco State Medical University, third year, fifth semester, group 4. I'm going to explain about the basic principles of the regional antibiotic therapy. So what is the regional use of an antibiotic? This is like they requires that the patients receive medications appropriate to their clinical needs in those that meet their own individual requirements, like for an adequate period of time and that the lowest cost that then and their community can pay. So why we should take the appropriate use of the antibiotics? Like to avoid adverse effects on the patients, avoid emergency of antibiotic resistance by ecological and societal aspects of the antibiotics, avoid unnecessary increases in the cost of the healthcare. So why we should prescribe an antibiotic? Is it necessary? Is it most appropriate to take antibiotics? What will be the dose, the frequency, the route, and the duration, and if this treatment is effective? So need to think also that antibiotics is used only for treatment of bacterial infections, and it includes that not all fevers are due to infection, and not all infections are due to bacteria, because there is no evidence that antibiotics will prevent secondary bacterial infection in patients with viral infection. And also we need to include that not all bacterial infections require some antibiotics. Need to consider also other options like antiseptics and surgeries. When we choose an antibiotic to prescribe to the patient, we need to consider also the etiological agent, consider the patient factors, and condition the antibiotic factors. So what are the ways of using the antibiotics? It can be oral or parenteral. In the traditional view, if the case of the patient is serious, it should be parenteral because it will more effective, faster effects in patient. And when this case is not so much serious, we apply the oral regimen to patient. So what are the advantages of the oral treatment for patients? The advantages are that we will eliminate risks of complications associated with intravascular lines. The duration in hospital will be shortened, and we can save nurses time, saving overall costs also. So what is the duration of this type of treatment? Like it will depend of the duration of this unknown agent that is causing the infection, and depends the people to people and the severity of the disease. So like some cases that if you apply higher doses to have shorter duration of the treatment, and some infections you need a minimal duration that is recommended, and some infections the dose can take months depending on the infection. Now I will show some minimum durations of treatments of some types of infections. Like for tuberculosis is 4 to 6 months, emphysema or lung abscess is 4 to 6 weeks, endocarditis is 4 weeks, osteomyelitis is 4 weeks, atypical pneumonia is 2 to 3 weeks, pneumococcal meningitis 7 days, pneumococcal pneumonia is 5 days. So how we will do the monitoring of the efficacy of the treatment? We will do early review of the response of patient. We will do routine early review in patient, and also we will increase or decrease the level of the treatment depending on the response of patient. Maybe we can change the route, we can change the dose, change spectrum antibacterial activity, and maybe we should stop the antibiotic. So now I'm going to show for you some examples of antibiotics, like from the group of penicillins that they are inhibiting the cell wall synthesis. And I will classify this by their class and generic names, common trade names, and common use. So the first one we have the amoxicillin, that common trade is amoxil or trimox, that they use for various streptococcus and staphylococcus infection. After we have the ampicillin, that the common trade name is Marcellin omnipen, and the common uses is for infection of the respiratory and urinary tract and blood meningitis, gonococcal infections, and endocarditis. After we have the penicillin G, that the common trade names is Bacillin, G pot, and Vicillin, that the common uses is for streptococcal and staphylococcus infections. After we have piperacillin, that the common trade names is Pipracil, that it is common uses for infections of the respiratory and genitourinary tract, skin, abdominal cavity, bone and joints, and blood. After we have the ticarcillin, that the common trade name is ticar, and the common uses for infections of the respiratory and gastrointestinal tracts, streptococcal and pseudomonas infections, gonorrhea, tonsillitis, Lyme disease, impetigo, otis media, and meningitis. So thank you for the attention and for watching my presentation. Las Vidania.